Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.
Right.
Marvin, you still there?
I'm still here.
Okay.
But this enableizer, see, I have senior dementia and then I have VA. VA doesn't charge me anything for that enableizer.
Well, with the senior dimensions, we can get it through total home care or preferred home care. So
It won't cost me anything?
From preferred home care.
He's worried about the cost.
Oh, I don't know if there's a copay with it, but I know we can get it. It's usually like $5.
Yeah, thank you for informing him. I want to know the cost.
Yeah. No, I mean, it's usually, there is a copay, but I think it's usually about $5 or something along that line. The VA is obviously going to be free, but you're going to wait eternity to get it. So the question being is that if you want me to relay to Melanie to order you a nebulizer, I'd be happy to do that.
Well, I think better yet, just make an appointment, come in and see her.
Well, he could do that too, but if he just wants to relay a message, then that's fine. Not a problem.
Yeah, well, I don't mind going in there. It's just that I don't like to take up somebody's time if she's busy.
Well, I mean, listen, she's not overwhelmingly busy. She's new, and we're trying to get her some business. So, so it takes time to build your clientele in a town. The reason Creig and I are busy is that we've been here for years, so we have a lot of clientele. But, I mean, if you're just starting out, now's the time to get in there, Marvin. She's got some extra time on her hands.
Well, I said VA doesn't charge anything for the enableizer. They charge for the, I guess, fluid, a liquid, whatever it is, the spray.
Well, I mean, they do different things. Sometimes they charge you for that. They shouldn't charge you for any of it if it's service connected. I don't know if your lungs are service connected.
No. No, I'm a Korean veteran, way back there.
Okay.
Before they ever started doing that.
Well,
so any prescription, if I go through there, like what do you call it, for indigestion, omeprazole,
yeah,
cost me $8 a month for it.
That's pretty cheap.
Yeah, I don't mind paying that, get rid of indigestion. I don't like that heartburn.
Yeah.
But I don't like taking prescription medicine. I've been offered it, and then I check with the pharmacist and to find out any side effects. Then I decide whether I'm going to use it, because one kind of prescription medicine is going to take care of what they prescribe, but may cause another problem like kidney, liver, or something like that, and I don't need another problem. My liver and kidneys are in pretty good shape.
Well, that's awesome. I mean, all I can really tell you is every medication does have a cause and an effect, and does affect another part of the body. So, you have to have a good indication for why you're taking the prescription that you're taking, and there's a risk-benefit ratio that always has to be evaluated with every medication. So, and as far as penicillin versus amoxicillin, the difference is a compliance issue, Marvin. Amoxicillin is 3 times a day, as opposed to penicillin, which is 4 times a day. And there's an interesting curve that talks about taking something once a day. There's an 80% compliance rate. You go down to twice a day and it's 60%, and it falls even further. So that means that you're most likely to miss a pill when you're taking something 4 times a day because it slips your mind during that day. Penicillin is a very short-acting antibiotic, and it's in and out of your system very quickly. So in order for an antibiotic to be an effective killer, it has to be in your bloodstream at a higher concentration than the bacteria to kill the bacteria for half the dosing interval. I know that's very complicated, but in terms to make it simple, if I give you something that's every twice a day, it needs to be in your bloodstream above a certain level for at least 6 hours. Okay, and penicillin doesn't do that. That's why it's given 4 times a day, because it only has to be, it can only be above 2 hours. So if you miss an antibiotic, you select for resistant bacteria.
Yeah, but no, not daily. It's,
yes.
When I took got a penicillin shot,
that's
it
different.
was 1 shot.
That's different because they gave you 10,000 or some 100,000 units of bicillin, and it's like glue, and it took a week for it to get out of your system. I mean, very, very long difference. That's the difference between oral and IM penicillin. And they also sometimes gave probenecid, which made the penicillin last even longer. So there was a lot of problems when they gave IM penicillin. If you were allergic to it, it was like glue in your butt, and it basically stayed there for a month, and you could have an allergic reaction for almost a year trying to get that out of your system. So that's what it was back in the day. Thank God we don't have to mess with that today.
Yeah, well, amoxicillin, she suggested not to take it if I didn't really feel like I needed it. I haven't taken it yet. From the time it's been about a month, I guess, when I picked it up. Wasn't that expensive. I think it would cost me $7.
Well, that's true. I mean, and that's a good plan. You don't want to take something if you don't need it, because you don't want to select for resistant bacteria.
Well, Reinhardt, she prescribed it, and I took it. In the description, that
hey,
it's
Marvin.
prescribed.
Marvin, let's table this discussion for another day so I can get someone else to call in. Okay.
Okay. Well, I'm just saying the amoxicillin didn't help me.
Okay.
And so that's why I've been holding off on this.
Okay. All right. Well, make an appointment and come see Melanie. Okay.
Yeah, I will.
Thank you, buddy. Well, I hate to, but it's a long discussion, and
he just needs to make an appointment, come in and see Melanie again.
Well, no, I mean, he raises very, very good points about antibiotics, and one of the good points about that is I like what has evolved in my antibiotic prescribing is I tend to use antibiotics for a very short period of time, 3 to 5 days, with the idea that your body has to have an intact immune system in order to fight these things off. If you're in the hospital and you get really sick, then they give you IV antibiotics, but it's the route of administration a lot of times will determine the concentration. And what I talked about was MIC, that's called minimum inhibitory concentration. That's how much is what every bacteria, every infection has an MIC. If you get in the hospital, there's a different MIC. There's a different MIC if you get something out in the public, because the bacteria are basically easier to kill. Chuck, good evening.
Hey guys, how you doing tonight?
Hey,
Good.
Chuck.
Good show again. This one's for Craig. Have you ever read The Body Electric by Dr. Robert Becker?
I have not read it, but I know people who have. I've talked about it a lot. I have a patient named Milo that is going through it right now. And I hear it's a very, very good book.
Yeah, I read it about 20 years ago, and I'm almost done rereading it, and it's amazing, what you forget over the years. But one of the more amazing things I found in it is they had a guy with both legs were broken, and his femur bone wouldn't mend. So he had a lot of bacteria, and what they ended up doing, Becker was experimenting on electricity, and and how it could affect healing and regeneration as well. But they used a positively charged silver electrode to get rid of the bacteria, which was massive, and then they used the negative polarity to stimulate the bone to mend.
Yes.
And it just blows my mind how you mentioned lasers before, how that aspect of medicine has been pretty much ignored in favor of the chemical aspect. And, you know, it's the chicken or the egg, but in my opinion, lasers and electric and all the rest, if it can stimulate the body to create the chemical reaction, it's a hell of a lot better than in introducing chemicals, which, like Dr. Reiner said, has the side effect.
Well, one of the problems again you have, Chuck, is it doesn't cost as much.
Yeah, exactly.
And that the medications and the pharmacology, you know, there's a lot more money made. But I can tell you, I've seen bone stimulators. They put them on the navicular when you break a wrist, because you have non-unions in that navicular, and I've just seen some amazing things with those bone stimulators. Yeah. The difference between electrical and light is night and day. The laser is a light therapy. The electrical is an actual electrical impulse, and we use it a lot interferentially for pain because it milks the tissue in the area that's inflamed, and we've got great results. And then on top of that, you know, you got the trusty old ultrasound with a little bit of phonophoresis in there, and it's very effective, and it's a very, very nice adjunct to go along, you know, with people that are using the medication.
Right, exactly. And you would much rather direct your therapy right at the site than you would have to take it by mouth and spread it all over your body only to get 4% at the site that you needed. Why poison everything else?
Great. You guys are wonderful. Thank you.
Thanks, Chuck.
See you later.
Yeah, that's why, you know, like you say, you use Voltaren gel, you use a little cortisone, you can put it right in there. I mean, you know, patients that get injections of cortisone into their shoulders and knee, it disperses throughout their body. You see their blood sugars go up. I mean, listen, I mean...
Yeah, the systemic effect is pretty dramatic. One of the things that we've been using and that I have been using on myself is the CBD cream.
Yeah, the oil.
And I got to tell you something. I cannot believe... It's very, very effective. It's very effective. So I'm going to start using it in the office. Yeah. I'll let people know that what we're using.
Right.
It's
and well, CBD doesn't turn the THC positive. No. It doesn't get them high. It doesn't anything like that. So I mean, but it has a lot of healing healing properties, and so that's pretty cool. I mean. Yeah, no, I mean, there's a lot of alternative remedies out there, and because they don't get, you know, Big Pharma doesn't put any money into it unless it's going to be prescribed for the rest of your life. There's no new antibiotics coming out, and if they do, the therapy is $6,000. Yeah. I mean, it's insane. It really is. So I encourage people to go to Mexico and buy everything they can.
And maybe, just maybe, this new president will do something about that.
Yeah, we hope so. Yeah. Happy President's Day, everybody.
Thank you, guys. Thank you, Pahrump.
We'll see you next week.